So when we opened, we anticipated that the numbers we were treating would climb, but they've climbed very quickly. So we have been open for just over 3 years now, and last year we treated nearly 200 patients. So that was a steep climb compared to the 80 or 90 just a few years ago. When we designed our model of how we deliver the care, as you know, we are collaborative with Brigham and Women's and Dana-Farber Hospital over in Boston. So they do a lot of our work with us. They do a lot of our safety checks, a lot of our double checks to make sure that we're delivering it to the highest standard here. And then we have the team here in Bermuda. And with Brigham's help with our modeling, their physicians, their doctors, see between kind of 60 and 100 to 120 cases each per year. So as I was the only doctor on island until a couple of weeks ago, I saw everyone, apart from when the locums came down from Brigham to cover me. And so we started looking about 18 months ago to increase our team and look for a new radiation oncologist to come and join us so that we could share the work and work together as a team. And Dr. Murray joined us a couple of weeks ago.
As oncologists, we tend to have niches. So my niche was head and neck cancer, but also lung cancer, specifically looking at targeted stereotactic radiotherapy, which is a newly developed radiation technique, mushrooming throughout the world in a number of sites. So I'm hoping to bring that experience to Bermuda, obviously in partnership with the Brigham and Women's in Boston, to allow us to offer more precise, intense radiotherapy in shorter courses. The machine that's on island is top of the range, the variant TrueBeam Linac. So it's got the capability of delivering these new intense radiotherapy techniques, such as stereotactic ablative radiotherapy. And that's where we deliver treatment, we target a concise area, and we deliver a large dose of radiotherapy in a small number of treatments, or fractions as we call them. We're using it for prostate cancer, we're using it for metastatic disease, where patients may develop a spread of cancer, and we can treat small areas to very high doses and ablate the cancer in those areas, which has been shown to have improvement in overall survival in recent studies.
The advanced techniques that Patrick is specialised in for radiation is something we've been intending to move towards for quite a while, and we're looking and working closely with Brigham in Boston about how we would initiate that and plan forward with it. But by being able to bring someone on island who's an expert in those extremely high-level advanced radiation techniques, the timing is perfect. Because it means less people will need to travel, because it's one area that we couldn't do here before. And we're also seeing that these techniques are being used in more and more different cancers, in more and more different situations. So it's important that we keep up with that technological change, and the best way to do it is by bringing an expert on island.